Support for the Preventive Medicine Lecture Series is provided by the Geisinger Commonwealth School of Medicine, the Wright Center for Graduate Medical Education, and by valued donors. Geisinger Commonwealth School of Medicine in historic downtown Scranton, in partnership with VIA Public Media and the Wright Center for Graduate Medical Education, presents the Preventive Medicine Lecture Series featuring Dr. Robert Ostfeld, Confessions of a Reformed Cardiologist, A Plant-Based Diet and Your Heart.
Good evening. Thank you everyone for coming out tonight to hear our esteemed speaker, Dr. Robert Ostfeld. Tonight's speaker was inspired by some of the very speakers who helped shape the Preventive Medicine Lecture Series. Physicians and scientists like Dr. Caldwell Esselstyn and Dr. Colin Campbell, our first and second lecturers. Through his talk, Confessions of a Reformed Cardiologist, A Plant-Based Diet and Your Heart, Dr. Robert Ostfeld will share personal reflections and stories of amazing transformations taken from his patient files, along with scientific data that demonstrates the powerful benefits of adopting a plant-based diet. Dr. Ostfeld is the director of a preventive cardiology program and the founder and director of the cardiac wellness program at Montefiore Health System in Bronx, New York. He founded this program after growing tired of watching patients follow the same predictable path from escalating doses of medicines to complex and invasive surgeries. He is also the Associate Professor of Medicine at the Albert Einstein College of Medicine. Dr. Ostfeld earned his BA from the University of Pennsylvania, graduating summa cum laude and Phi Beta Kappa, his MD from Yale University School of Medicine, and his Master's of Science in Epidemiology from the Harvard School of Public Health. Dr. Ostfeld completed his medical internship and residency at the Massachusetts General Hospital and his cardiology fellowship and research fellowship in preventive medicine at Brigham and Women's Hospital, both teaching hospitals of the Harvard Medical School. His professional interests include cardiovascular disease prevention, medical education, and clinical research. He earned the Outstanding Full-Time Attending of the Year Award at Montefiore for excellence in teaching medical residents, the Program Director's Award for dedicated service on behalf of the Montefiore Einstein Cardiology Fellowship, and was elected to the Leo M. Davidoff Society at Einstein for outstanding achievement in the teaching of medical students. How exciting that he can take the time to come and meet us in Scranton. I first heard Dr. Ostfeld speak about 3 years ago at a wonderful conference about plant-based nutrition in the Catskills on Dr. Esselstyn's family farm. I'm really excited and proud to have him here with us in Scranton to hear about how his program has grown and how he and his team are helping patients not only to prevent heart disease, but also to regain their health and vitality through just some wonderful, simple lifestyle changes that we can all do. Please welcome to the stage Dr. Robert Ostfeld.
Well, thank you for that incredibly generous introduction. And it's an honor to be with you all here today and to see what you all have created here in Scranton and with Geisinger, this incredible medical school with focus and attention on nutrition and nutrition education. It's really trailblazing in its mission and helping to fill a gigantic void, and is a wonderful example for other schools across the US and the globe. So thank you all for your incredible work. So, Confessions of a Reformed Cardiologist, A Plant-Based Diet and Your Heart, that's me. Like many of you, I got interested in health and the health field because I wanted to help people get better. And so I went to medical school and residency and fellowship, and I learned a lot of incredible things, medications, procedures, had lots of wonderful mentors, but I learned that was 11 years. I learned virtually nothing about nutrition. And unfortunately, that's a very common theme. Things are starting to change, in part because of the great work that's going on here, but things are starting to change, but it's a very common theme. And when I finished up my fellowship, I kind of knew that a Mediterranean-style diet was good, but I couldn't really define it. And so I went down to Montefiore to start the work and did all the things I was trained to do, guideline-based medications, procedures, asked people to have a Mediterranean-style diet. And people got a little bit better, but they didn't get a lot better. And I didn't go into medicine to help people get a little bit better. I really wanted transformational change. So I was starting to get disillusioned. And it was right around that time that I stumbled across the book, The China Study, by Dr. Colin Campbell, who I know spoke here before. And he's an incredible mentor and leader and pioneer. And anyway, so being a myopic cardiologist, I went straight to the little section in the middle about cardiology. And I was really taken by it, and also by the incredible work by Dr. Esselstyn, who's become an incredible friend and mentor to me in our program. And one thing led to another, and started our cardiac wellness program at Montefiore with the goal of preventing and reversing disease with a plant-based diet. And I say disease, not just heart disease, because as you all know, yeah, it's good for your heart, but it's good for you for dozens and dozens of other reasons. And we quite literally have patients crying tears of joy in our office that they feel so much better. And like nobody cried tears of joy when I write them a prescription for a cholesterol-lowering medication. And it's just been incredible. We have, people losing 90 pounds, coming off 10, 12 medications, going from walking 2 blocks to, being able to chase after their grandkids. People who choose to not have procedures like bypass surgery, be able to turn things around. I mean, procedures certainly can be helpful at times, but not everybody wants to do them. It's just really rejuvenated me as a physician, but more importantly, it's been incredibly helpful for our patients and the general community. So it's just been an incredible adventure. And I'll dive a little bit more into our program later. I should say, one of my disclosures, I consulted for Better Therapeutics for a few days last year. So I want to talk a little bit about epidemiology. I'm going to weave together a couple of talks. So epidemiology is, how common the disease is. So I need some audience participation. What percentage of 12 to 14-year-olds in the US do y'all think have early signs of cholesterol disease in the blood vessels that feed their hearts with blood? 80%. So I'm hearing somewhere between 20 and like 90 or so, and but no one's gonna pull Price is Right, like the 1% kind of. Well, so you guys are absolutely right. It is indeed somewhere between 20 and 90%. So, but you guys are, you're way better than the medical students I typically work with, because they usually give me between 0 and 100%, because they're professional test takers. So it's about 65. About 65% of 12 to 14-year-olds in the US have early signs of cholesterol disease in the blood vessels that feed their heart with blood. And we know this from pathology studies of kids who've died for other reasons. And then they looked at the heart. Now I'm looking around the room, and I'm pretty sure that we are all older than 12. I mean, maybe not emotionally, but certainly, at least numerically. So about 2 heart attacks happen every minute in the US. A heart attack is when part of the heart muscle dies from a cholesterol blockage. It's the #1 killer of adult men and adult women. Women are about 6 to 7 times more likely to die from cardiovascular disease than they are from breast cancer. Now, clearly, you don't want either one, but it highlights the epidemiologic importance of cardiovascular disease in women. And it's a very expensive disease process, and about half of heart attacks happen in people with, quote, normal cholesterol levels. So in our country, where it is normal to die from heart disease, I think our notion of normal is anything but. So an outline, so we'll talk a bit about a plant-based diet. We'll talk about a Mediterranean-style diet. I recently gave a debate about these topics. Compare that to a plant-based diet. We'll talk about a ketogenic diet or low-carb diet. Compare that to a plant-based diet, and we'll make some conclusions. So when I say plant-based diet, what do I mean? I mean, basically, if it has a face or comes from something with a face, don't eat it. And it includes a minimally processed plant-based foods, or excludes, or basically nearly excludes all animal products. So tons of vegetables, fruits, whole grains, beans, lentils, nuts. So to my knowledge, the only dietary pattern that's been shown to actually reverse coronary disease is a plant-based dietary pattern. And in this interesting study, lifestyle heart study done by Dr. Ornish, they took people with stable cholesterol blockages in their heart. And then they randomized them into two groups. Group number one was an intervention where they had a plant-based diet, but they did have a little bit of low-fat milk, and exercise psychosocial support versus expert care from cardiologists just like me. And then they looked a year later at the size of the blockages in their heart. Guess which group won? Well, the intervention arm with the exercise and the diet, their blockages shrunk in size, and expert cardiologists like me, blockages grew. Fast forward 5 years, the trend just continued, shrunk more, grew, blockages got bigger, and after 5 years, the experimental arm had about a 2.5 times lower odds, of having a cardiovascular event. And not surprisingly, there's kind of a dose-response relationship, which gives further credibility to the pathophysiologic rationale of this actually truly being helpful. So the more you adhere to the healthier lifestyle, the more your cholesterol blockages shrunk. And this is also supported by a great study in India where they did a similar kind of an intervention, and they found that for people who did it more than 50%, their cholesterol blockages also shrunk. But okay, reversing coronary disease, that's great, and fewer events. A plant-based diet also improves a variety of cardiovascular risk factors. So CRP, or inflammation. Increased inflammation promotes all kinds of diseases, high blood pressure, diabetes, maybe some cancer, and also coronary artery disease. So in this really cool study done at NYU, they took 100 people with cholesterol blockages, and then they randomized them into two groups, a vegan diet or the American Heart Association diet. And they looked at what happened to inflammation. Guess which one won? The vegan diet significantly lowered inflammation more. Okay, that's great. What about cholesterol? Well, in an interesting randomized study by Dr. Jenkins in Canada, they found that a plant-based diet lowers LDL cholesterol about the same as a cholesterol-lowering pill in their study, around 30% or so in each. And the higher the LDL, the higher the bad cholesterol, the worse you do, the lower, the better. But those LDL particles can become oxidized, oxidative stress. And when they become oxidized, they become particularly irritating to blood vessels, kind of like a splinter. Well, it is more difficult to oxidize those LDL particles when you look at vegetarians compared to omnivores. The vegetarians have LDL particles that are more protected against becoming oxidized. What about blood pressure? We call high blood pressure the silent killer because you don't feel it, but it kills you. So eating more of a plant-based diet is associated with less elevated blood pressure. And in a cool study by the EPIC Oxford study, which is a really big prospective cohort study, in this cross-sectional analysis of it, they found that the people eating the plant-based diet had the lowest blood pressure, and even if you just added some fish to your diet, your blood pressure was even higher. Lipoprotein little a is basically a cholesterol particle that attaches to the LDL particle. Who cares? Well, the more you have of the lipoprotein little a, the worse that you do. It's particularly atherogenic, particularly bad for blood vessels. But we don't really have a lot that we can do for it yet. The people who are studying it, but there's no great medication to lower it yet. And in an interesting case series by Dr. Baxter Montgomery from Texas, he found that a plant-based diet lowered lipoprotein little a about 16%, which was statistically significant. So a plant-based diet also improves more novel risk factors. What about our genes? Well, we can't change our genes, or make our eye color, our hair color, but we may be able to change which ones speak. And in another really cool study done by Dr. Ornish, they took people with early stage prostate cancer. And they biopsied the prostate, and then they had them have this healthier lifestyle, exercise, psychosocial support, and almost nearly a plant-based diet. And then they biopsied the prostate about 3 months later, and they found that dozens of pro-cancer genes were downregulated in their expression, and many anti-cancer genes were upregulated in their expression. So you couldn't change your genes, but you were able to change which ones speak, making the healthy ones speak more loudly and the unhealthy ones speak more softly. It's pretty mind-blowing. But one other thing, as an aside, that's even potentially more interesting is in animal models, that on and off switch, turning on the healthy genes and off the unhealthy genes in animal models, gets passed on to our kids and our grandkids. So what an incredible responsibility. The food that you eat today, yeah, it touches the environment. Yeah, it touches your health. But it may touch the health of your kids and grandkids. Okay, so novel risk factor, the microbiome. So that's kind of the new buzzword these days. And we all have about 1 trillion gut bacteria hanging out in our colons and small intestine. And so, you could really say that we're the parasites, not them. We've got 1 trillion of them. But the interaction that we have with them is incredibly complicated. We're just scratching the surface of our understanding. And it is incredibly impactful to health. And the population of your microbiome can either be quite healthful for you or unhealthful. And when you eat a plant-based diet with a minimally processed one with more fiber, I don't mean sugar cookies and white bread, you are going to select for healthier gut microbiome. And that healthier gut microbiome eats fiber that we eat, and it makes something called short-chain fatty acids, like butyrate. Who cares? Well, those things seem to do a myriad of healthful things for us. For example, that butyrate, that short-chain fatty acid, goes into the enterocyte. That's the cell that lines the inner wall of the colon, making it healthier. It can down-regulate genes that in the enterocyte that create cholesterol, so lowering your cholesterol. They're anti-inflammatory. They can even go to your brain, and it's associated with improved health. The mind-gut connection, well, that may be part of it. In addition, when they make the enterocyte healthier, they make that cell make more mucus. So you have a teeny tiny thin little layer of mucus that is between the microbiome and that enterocyte. Who cares? Well, you don't really want the microbiome and the enterocytes to touch because your body is going to see those bugs as foreign and attack it. So you want them really close to each other so they can work well together, but you don't want them fully hanging out together. But if your enterocyte is not as healthy, that mucus layer gets thinner, the microbiome can touch on those cells more, and your immune system can attack it and kill those bugs. Who cares? Well, those bugs have something called lipopolysaccharide attached to them, and that's how they hook onto the mucus. So what? Well, that lipopolysaccharide, if you kill that gut bacteria and absorb the lipopolysaccharide, that creates tons of inflammation in your body and can be quite detrimental to health. And you may have heard about people who are really sick with an infection, they get sepsis. A lot of the hemodynamic or blood pressure problems that they have are because of the lipopolysaccharide from that particular infection in their blood. But what you're doing with the gut microbiome is introducing a very low level of lipopolysaccharide, which can create tons of inflammation. And in mouse models, consuming more of a plant-based diet, having a healthier microbiome, is associated with less atherosclerosis. And I'll make one other microbiome point, because it's just incredibly interesting. And of course, eating more plant-based foods selects for a healthier microbiome. They did this really cool study. And they took vegans and they took omnivores and they fed them a steak, all in the name of science. And what they were looking for is how much TMAO, trimethylamine oxide, do you make? Well, who cares? Well, more TMAO, it's not your friend. It promotes inflammation, it promotes diabetes, prostate cancer, cardiovascular disease. You want your levels to be lower. Well, it turns out that the omnivores, when they ate a steak, made a good bit of trimethylamine oxide, and the vegans made much, much less. What's going on? Well, what's going on is our gut microbiome. Because when you eat animal-based foods, you select for bacteria that interacts with the L-carnitine in the steak, and through a variety of steps, makes trimethylamine oxide. But when you eat a plant-based diet, you select for far fewer of those bacteria. So you make ultimately much less trimethylamine oxide. But how you eat is critically important because your gut microbiome population can change very quickly. In humans, even within 3 to 5 days, go from being quite healthful to not to back again. All right, myeloperoxidase levels, MPO. Those are pro-inflammatory, pro-oxidant. Higher levels are associated with more heart attacks. Your levels in vegetarians are lower than those in omnivores. For those of you who came to hear Dr. Esselstyn speak, you know he spends a lot of time talking about the endothelial cell. And those are the cells that line the inner walls of our blood vessels in our body. And we need to keep them healthful. We keep them healthful, they treat us well, and vice versa. And those endothelial cells, like all parts of our body, get replenished over time when they get old and tired. And our bone marrow makes endothelial progenitor cells that go out and replace the older and sicker endothelial cells. So, and we know the higher the level of endothelial progenitor cell in your blood, the better you do. So in an interesting study, they took young Okinawan women and randomized them to their usual diet or their usual diet plus more green leafy vegetables. Well, when they ate more green leafy vegetables, they made more endothelial progenitor cells. So plant-based diets may reverse coronary disease, are helpful for a variety of traditional and more novel risk factors. What about diabetes? In a randomized trial, where they took people with adult onset of type 2 diabetes, they randomized them to a plant-based diet versus the American Diabetes Association diet. Guess which one won? The plant-based diet, their blood sugar fell numerically more, they came off way more medications, their cholesterol fell more, and they lost more weight. A variety of epidemiologic studies supports that as well. For example, the Seventh-day Adventists. Weekly intake of animal products or more versus none. If you were in that weekly or more, you had a 74% higher odds of having diabetes. The Rotterdam study, the more plant-based foods you ate, the less likely you were to develop diabetes. And in a small randomized trial, consuming a plant-based diet improved insulin resistance and beta cell function, the cells that make insulin in our pancreas. And we can dive in a little more about insulin resistance if we have time. So along the lines of consuming more of a plant-based diet, diet's not a continuum, it's not all or none. You know, there's some diets that are a little bit better and a little bit better, and the more plant-based foods you eat appears to be better. And in this really cool study by Satija, where they looked at, I think it's around 200,000 people with about 4.8 million person years of follow-up. So you follow me for 1 year in a study, that's 1 person year. They have 4.8 million person years of follow-up. And what they asked is, what happens if you eat more plant-based foods? Is it good? Is it not good? So this bluish line here, this is the more of a plant-based diet index you eat. The more you eat, the lower your likelihood of developing coronary heart disease. Great. But they're like, you know what? You could be plant-based if you eat kale all day, and you could be plant-based if you eat sugar cookies all day. There's got to be a difference. So they're like, well, let's look at that. So here, this red line is a healthy plant-based diet. Vegetables, fruits, whole grains. They did even better. Well, this is the unhealthy plant-based diet. Sugar cookies, white bread. They did worse. And if you look over here, this is the healthy plant-based index. The more you ate, the better you did. This is the less healthy plant-based foods. The more you ate, the worse you did. What's this red line? That's animal foods. In this study, if you ate animal foods, you did a little bit better than a junk food plant-based diet. So the devil is really in the details. And accordingly, in a meta-analysis, for every additional serving of fruit and vegetable you had per day, that was associated with a 5% reduction in mortality. This is a cool study. They looked at about 130,000 people, 3.5 million person years of follow-up, and they asked, if you replace just 3% of your calories from plant-based food, from animal-based foods, with 3% of calories from plant-based foods, is it good? Is it not good? What happens? Turns out it's good. If you replace just 3% of your calories from processed red meat with 3% of calories from plants, that's associated with a 34% lower hazard of death. How about unprocessed red meat? 12% lower hazard. And just to pause for a second, as you all may know, the World Health Organization has come out and said that processed red meat, like bologna and stuff like that, is a class 1 carcinogen. That means it causes cancer. That's the same category as smoking. And they called unprocessed red meat a class 2A carcinogen, meaning that it is likely carcinogenic. How about poultry? 6% lower hazard. Fish, 6%. Eggs, 19% lower hazard. Dairy, 8%, all significant. So plant-based diet's the only dietary pattern shown to reverse coronary disease, to my knowledge, improves a variety of risk factors, improves a variety of novel risk factors, and is associated with living longer. What about a Mediterranean-style diet? A Mediterranean-style diet is a good diet. And in its traditional form, probably in the island of Crete in the 1950s, is pretty much almost exclusively plant-based, and they're also very active. So in the continuum, it's pretty good. And there is data for people who have had heart attacks and who have not had heart attacks that compared to a more traditional Western diet, people do better on a Mediterranean-style diet. However, there was the PREDIMED study was an interesting randomized trial that took people with risk factors for heart disease, but not overt heart disease, and randomized them to a Mediterranean-style diet versus basically a Western diet. And the Mediterranean-style diet did better. But they asked, what happens if you were in the Mediterranean arm, the arm that did better, if you ate even more plant-based? Did that change anything? Turns out it did. In this analysis, if you ate a pro-vegetarian dietary pattern, meaning lots of vegetables, fruits, legumes, cereals, potatoes, and nuts versus no animal products, including no fish, if you were in the highest quartile versus the lowest, that was associated with a 41% lower hazard of death. So under the umbrella of a Mediterranean-style diet, the more plant-based you went, the better you did. And this is also backed up by the EPIC study, a big prospective cohort study, that with every standard deviation increase in fruit and vegetable consumption, that was associated with a 14% reduction in death. In the Greek EPIC prospective cohort analysis of about 23,000 people followed for 8 years, they found that if you had a higher Mediterranean diet score, you did better. So the more of a Mediterranean-style diet you ate, the better you did. But then they asked, well, what is driving that score? So for them, it was moderate alcohol, low meat consumption, high vegetable consumption, high fruit and nut consumption, high monounsaturated to saturated fat, meaning more plants, and high legume consumption. Cereal and dairy had minimal impact, and in this analysis, fish and seafood, there was a trend toward increased mortality. So also in this analysis, under the umbrella of the Mediterranean-style diet, eating more plant-based nutrition was better. the Adventist Heart Study, or the Seventh-day Adventist Study, this is a cross-sectional analysis of about 60,000 people. And they were able to look by diet. The Seventh-day Adventists that treat their body like a temple have a lot of different healthy lifestyles. And even those who eat an omnivorous diet in this religious organization, they eat typically a more healthful version of the Western diet than the average Westerner does. And they were able to break it down by different dietary patterns: non-vegetarians, semi-vegetarians, pesco, fish vegetarians, lacto-ovo-vegetarians, vegans. The group with the lowest percentage of diabetes was the vegans. And the same theme for body mass index. We know that less than 25 is considered normal. The only group with normal was the vegans. So for a Mediterranean style diet, it appears the more plant-based it is, the more optimal. What about a keto or low-carb diet? So I think that the keto diet is based on a myth. And that myth is that around 1980 or so, we were told to eat low fat. We ate low fat. Look at us now, we're fat and sick. So they may have told us to eat low fat in 1980, but we didn't do that. We ate more of everything, including fat. So that kind of nice tied up into a bow little story, to me, is fake news. There is no long-living society that lives in a chronic state of ketosis. People often bring up the Inuit population. They live really far north. They eat a lot of fish. And they're like, well, they live really long. Well, that's not true. They live about as long as a typical Canadian does. And that population actually selected for a mutation that makes it harder for them to go into ketosis, suggesting that it is not healthful, that it is not a healthful state to be in. And if you look at the longest living populations in the world, the blue zones, with the highest number of centenarians, there's one in Sardinia and Costa Rica, and the Seventh-day Adventists in Loma Linda, California, and Okinawa, and I'm forgetting somewhere. Their diet is more than 50% carbs, okay? The longest living populations are eating more than 50% carbs. Now, it's healthful carbs, whole grains, beans, etc. And the Siman population, they are an indigenous population in the jungles of Bolivia, and they were recently studied, and they have the lowest rates of heart disease ever recorded in the medical literature. Their diet, 72% carbs. How do we know? And it's whole grains. They don't have, there's no convenience store down there. How do we know that they have such low rates? Well, the investigators flew down CAT scan machines because they took CAT scans of the heart looking for coronary calcium. It was a pretty impressive undertaking. And so their vascular age is 25 years younger than the average American from the MESA cohort. It's a prospective cohort study. About 25 years younger. And they're pretty active. They eat 72% carbs, 14% protein, 14% fat, and they're also pretty active. And interestingly, they have a lot of inflammation. Their inflammation levels are very high because they have a lot of parasitic infections. So I think it's based on a false myth. There are almost no hard outcome studies. In fact, I don't know of any hard outcome studies, meaning heart attack, living longer, with a low-carb / ketogenic diet. And the side effects are real. This is a dietary pattern that can be useful in people with refractory epilepsy. And it's used in the pediatric population for that purpose. But it's considered so potentially dangerous, they'll typically start it in the hospital, and it has lists of side effects. These are published in the literature. It's not a one-off here or there. Arrhythmias, cardiomyopathy, meaning the heart beats more weakly than normal, kidney stones, fractures, pancreatitis, vitamin and mineral deficiencies, among other things. So, okay, what are the mechanisms of potential harm eating much more animal-based foods? Well, heme iron is one. Heme iron is the form of iron that's in animals, animal products. Plants typically have a different kind of iron. Well, that kind of iron promotes inflammation, can promote prostate cancer, diabetes, and may be associated with more heart disease. Nu5GC, what the heck is that? It's a sialic acid, and it's found on the cell membranes of non-human primates. Who cares? Well, in animal models, I made a mouse model that looks like us. We don't have Nu5GC in our cell membranes. And the animal model ate regular meat with Nu5GC, and that got incorporated into their cells and on their cell membranes. Well, the body, their mice bodies, looked at that as foreign, because it was a foreign protein, and it would attack it. And it would create all kinds of inflammation. They had like 4 or 5 times more cancer, lots more inflammation, and the author speculated that this may be one of the reasons why red meat consumption, when we eat that, is associated with more heart disease and diabetes. The microbiome, we discussed in detail. Advanced glycation end products are more common in animal foods and through the cooking mechanisms, and they promote inflammation, diabetes. Eating more animal-based foods can increase LDL or bad cholesterol. Antioxidants. Animal-based foods on average have about 64 times less or fewer antioxidants than do plants. And berries have about 90 times more antioxidants than do fish. And in a mouse model, they had them eat their usual chow, a more Western diet, and a low-carb diet. I think their usual chow is like high carb. The Western diet was like middle, and low carb was very low. And they had them eat that, and they looked at them, and their weights and their blood pressures were the same, but then they looked at their blood vessels after a number of weeks. And the low carb group had way more atherosclerosis than either of the other two groups. But their blood pressures and weights were the same. Well, it turns out that the number of endothelial progenitor cells, which we know are helpful, were much lower in the low-carb group. And the low-carb group had higher levels of non-esterified fatty acids, which promote inflammation. So it's important to know that even if some of the more traditional risk factors may be the same, there's much more detail going on beneath the surface. And that just brings me to the theme of, like we've talked about, all these kinds of novel risk factors. And I look at nutrition really as a symphony. It's a symphony of, like in a symphony, there's the violin, and then there's the piano, and then there's the drum, and on it goes. Well, and so that's the blood pressure, and then there's the microbiome, and then there's Nu5GC, and then there's heme iron. All of those things make up the symphony. But we're just scratching the surface of all the things that are in the symphony. We're learning more and more. And so I look at the blue zones as a representation of that symphony. The blue zones take into account the microbiome and the Nu5GC and the dozens of things we don't even really know about yet. And they're eating almost exclusively plant-based, and they're the longest living populations in the world. So for me, kind of teleologically, if you will, they are the manifestation of a healthier symphony. So why in the world, given all the stuff we just talked about in regard to a ketogenic diet, would people even eat it? Well, for two reasons. One is weight loss, and the other is diabetes. We'll get to both. Well, in terms of weight loss, a ketogenic or very low-carb diet is effective for short-term weight loss. But so is cholera. So when you go on a low-carb or ketogenic diet, you use up all your glycogen or sugar stores in your body, those retain water, so you pee that out, so you lose some weight. You get something called the keto flu, so you kind of feel a little crummy. This could happen for a couple of weeks, so you eat a little less, you lose some weight. And the ketones themselves are water avid, so you pee them out. And so that helps you lose weight too by losing more water. So it is useful for short-term weight loss, but in meta-analysis of 13 studies lasting more than 1 year, a lower carb dietary pattern had less than a kilogram more of weight loss than did higher carb dietary patterns. Diabetes, so when you eat a no glucose, a very, very low carb diet, the blood sugar levels in your blood will go down. But when you're eating all those animal products, they help promote the underlying reason why people have diabetes in the first place, the insulin resistance, through the inflammation, the saturated fat, et cetera. And that's a long conversation we can get into some. But when you eat lower carb, it can mask that insulin resistance by lowering the blood sugar, but not getting at the underlying reason for why you have it in the first place, the diabetes, adult onset diabetes in the first place. And in a meta-analysis of long-term randomized controlled trials, they found no difference in sugar control in a keto diet versus a higher carb, low-fat diet. So we talked about a variety of mechanisms, populations, et cetera. Now these are other population-based studies. In a prospective analysis of about 4,000 people, I believe it was the health professional follow-up study and the nurses' health study, they looked at people who had had an MI, a heart attack. And those eating more low carb were more likely to have a heart attack, and those who then switched to a lower carb diet after the heart attack did worse. And a variety of other prospective cohort studies have similar themes in terms of eating a lower carb diet. They did worse. And interestingly, in an analysis presented at the American College of Cardiology conference just 3 weeks ago or so, eating more low carb is associated with more atrial fibrillation or an abnormal heart rhythm that can cause stroke. Okay, well that's great. But when you eat this low carb pattern, you are leaving out among the healthiest foods in the world. Okay, whole grains. There was a meta-analysis published in Lancet with 135 million person years of follow-up, and the more whole grains you ate, the better you did. The longer you lived, the less cancer, and the less diabetes. Yes, you ate more whole grains, and you had less diabetes. It leaves out pulses, which are beans and lentils. That's associated with living longer. It leaves out fruit, among the healthiest food in the world. And in this analysis, they asked, by Dr. Dew, they asked if you eat, this was in about 480,000 people, if you eat more fresh fruit, is that good? Is it not good? Turns out it's good. If you eat more fresh fruit, that's associated with less incident diabetes, so less likely to develop diabetes. And what about death? And what about if you had diabetes in the first place? In their study, they had 30,000 people who had diabetes in the first place. And if you ate more fresh fruit, you did better. It was associated with living longer and associated with less heart attack, less kidney disease, less eye disease, things that are very bad complications of diabetes. So eating more fruit was associated with lower incident diabetes. I'm kind of getting tired of hearing about how fruit causes diabetes. And this similar analysis, more fresh fruit was associated with less heart disease, less stroke. Oh, yes, and the American Association of Clinical Endocrinologists, their guidelines for patients with adult onset diabetes include a plant-based diet. So, for a ketogenic or low-carb dietary pattern, no long-living population. Isn't a chronic state of ketosis, no hard outcomes that I'm aware of. We need way more safety data, and epidemiologic or population and mechanistic studies do not support benefit, and to me suggest harm, and you are giving up among the healthiest foods in the world. This is a cool table. Plant-based versus Mediterranean versus ketogenic or low-carb dietary pattern. Per 500 calories, the plant-based is equal parts tomatoes, spinach, lima bean, peas, and potatoes. Mediterranean is about 40% of this, and then half a piece of skinless chicken, 1 teaspoon of olive oil, and 1 cup of 1% milk. And the keto or lower carb is equal parts beef, pork, chicken, and whole milk. Let's see. You don't need to eat any cholesterol. Your body will make all you need. What about protein? Oh my God, my muscles are gonna fall apart. Don't believe me? Now, this is the Mediterranean style one, and this one has more protein, but you don't need anywhere near that much. And if you don't believe me about a plant-based diet and protein, ask Patrick Baboumian. Patrick Baboumian is the world's strongest man, and he's vegan. How do I know that he's the world's strongest man? I know that because he won the world's strongest man contest. How about beta-carotene? It's subtle. What about dietary fiber? Your constipation will go away. We have bones to keep us standing. Plants have fiber. How about iron? Oh my God, I'm going to become anemic tomorrow. Calcium, my bones are going to fall apart. So doc, I did everything they told me to do. Why did I have a heart attack? Well, that's because we haven't been telling you the right things to do. This is a great quote by Dr. DeVries and also reinforces how incredibly important the work you all are doing here. It struck me as a peculiar paradox that guidelines, those are medical documents that help us think about how to practice medicine, highlight the primary importance of nutrition and lifestyle. Yet the physicians who are expected to implement these guidelines receive absolutely no education in these areas during their residency and subspecialty training. So football season's back on, right? So you all remember that great Super Bowl ad last year about broccoli. Right, look, of course you don't, because there was none. You know, there's no big broccoli. So I thought, like, well, what are we up against? So I looked at advertising dollars spent in 2004. And the top 8 fast food chains, although some of them have been adopting now plant-based food, the top 8 fast food chains, they spend $2.3 billion with a B dollars on advertising. And some of you may remember there was a federal program, 5 a day, have 5 servings of fruit and vegetables a day. Around that time, they spent $4.9 million. So I could not make sense of those numbers in my head, so I turned them into seconds. 2.3 billion seconds, 4.9 million seconds. That's 73 years versus 2 months. But times are changing with the great medical school you have here, and Dr. Kim Williams, I know he spoke here, and he recommends a plant-based diet because, quote, I know it's going to lower their blood pressure, improve their insulin sensitivity, meaning improving diabetes, and decrease their cholesterol. This is a busy slide, but it's a cool study. So a question I typically get is, or a comment I get is, oh, doc, you know, my dad and my grandfather had this, and you know, it's just in my genes. I'm gonna get disease, you know, I'm gonna get heart disease, I'm gonna get diabetes, it's in my genes. Well, genes matter, but lifestyle matters too. Lifestyle also runs in families. So in this analysis, they took a variety of cohort studies and they looked at a genetic risk score. Meaning, and the more of those genes you had, it was bad for heart health. So not surprisingly, the more of the genes you had, they found, the bad heart genes you had, the worse your cardiovascular outcomes. Okay, so this is the highest genetic risk group, this is the middle genetic risk group right here, this is the lowest genetic risk group. So the higher your genetic risk, the worse you did. But the cool thing about this study is that they then split people into lifestyle groups. A not healthy, middle of the road healthy, and a healthy lifestyle group. Well, this is the high genetic risk group here. This is the unfavorable lifestyle. They all had a similar genetic risk. This is a high unfavorable lifestyle. This is being in the favorable lifestyle group. So you, just by changing your lifestyle in this study, were able to lower your cardiovascular risk by about 50%. But you know what's even more interesting? How did you get into the favorable lifestyle group? Well, you exercised at least once a week. And you ate more healthfully than about 50% of the people in the whole study. Well, what if you exercise 4 times a week? And you eat more healthfully than 90% of the people in the study. You think the risk would fall even more. Genes matter, lifestyle matters too. Oh yeah, this brings me to our program. This is New York City, this is Jersey. I had a really hard time getting out of Manhattan today. Lots of traffic, just FYI. Anyway, I work here in the Bronx, and this is where our program is based. There's a little under 2 million people there, and about 85% of the patients who come to Montefiore who live in the Bronx are on some degree of public assistance. There's a large indigent patient population there, so I'm proud to be able to have our wellness program there. So that's the context of our program. And our program has a few arms. It started like 6-7 years ago with an outpatient arm. And what I do there is anytime I see a patient, I will weave plant-based nutrition into their care. And I do all the stuff that you all do, history, physical, medications, do all that stuff. And then I talk about how plant-based nutrition will be incredibly important for that particular person. You try to find a hook. Do they want to lose weight? Do they want to come off a certain medication? Do they want to avoid a procedure? Whatever. Do they want to walk their kid down the aisle? Whatever it may be, try to find a particular hook and talk about how the plant-based nutrition will be helpful. And we give them handouts. I'll show you one or two in a moment with specific guardrails about how to eat. We have these periodic Saturday morning sessions modeled after Dr. Esselstyn's work, where they're about 4 hours. I speak, a nutritionist speaks. We have patients come with a friend or significant other to help them along the way. We serve lunch. We don't charge patients for it. I fund the whole thing through donations. And we ask patients to come to that, and we follow up with them the best we can over time. Like most wellness things, we are unfortunately under-resourced. And so that was going on for a while, and we're having some wonderful successes. But I also round in the hospital. So I go see a cardiac patient in the hospital. I walk in, I'm like, rah, plants. And then I leave, and dinner's served, and it's chicken. And I'm totally undercut. So I'm like, this isn't working. So what I did is I met with nutrition and food services, and we developed plant-based meals that we can now order for patients. You can still order the other stuff. Nobody wants to be told what they have to do. But you can also order plant-based foods. But that wasn't enough, so you can order that for patients. But that's not enough. It comes with a handout with some information and resources, real short. But that wasn't enough because I'm not going to have time to have a 30-minute conversation with each patient I round on in the hospital. So we needed to outsource some of the education. So the documentary film, Forks Over Knives, plays on continuous loop in our inpatient TVs with Spanish subtitles. So you can watch CBS, but you can also watch Forks Over Knives. So now I can walk into a patient's room, I go rah plants, we can order the meals with the handout, and I can put on Forks Over Knives, and it can help me orient patients to it. I don't expect that I'm gonna make everyone fully plant-based with this intervention, but I do expect that it's gonna plant a meaningful seed, and that's my hope with it. And so that's been really wonderful, and I could dive into more detail with that later. We have an educational arm as well, and probably the marquee aspect of it is our annual conference. We're on our third year coming up now, and of course I left my the save the date cards in the wonderful Colonnade Inn I'm staying in tonight. Left them there, of course. So it's been a wonderful adventure. We've sold out our first 2 years. Hopefully y'all can come. There'll be a website I'll put up there in a second. And Dr. Esselstyn will be there, Dr. Walter Willett will be there, many other people, and it'll be wonderful to have you all there. We also have a research arm as well, where we do small case reports, case studies, review articles, and we're about to embark on a small randomized trial as well. So it's really been an incredible adventure. This is one of our handouts. That I'll give to patients in clinic. I have 3 levels, because I should say patients come to see me in 2 buckets. Bucket number 1 is they've heard about our program, so they're already starting on like second base. But the majority of the patients who come and see me, they've never heard about it before. And when I mention plant-based nutrition in the Bronx, they'll look at me like I'm from Mars. They've never heard of this. So I have 3 levels, and 2 of them have some animal products in it, and I try to get people all the way up to level 1. And so I'm like, all right, so they have checklists, 3 servings of green leafy vegetables a day, 3 servings of other vegetables and fruits, and on it goes throughout the day. Those are their guardrails. We have a bunch of other information we give them. Oh yeah, this is how to transition your home into a disease-fighting powerhouse. We made it sound really dramatic. Anyway, this is advice about how to transition your home, because it's practical. It's hard to do that. Exercise is a part of our program as well. We encourage people to do at least 20 minutes of exercise a day, whatever they can do. But This is the Vegas Strip, and as you can see, though, nobody takes the stairs. But that's okay, because I went to the American College of Cardiology conference. I'm like, you gotta be kidding me. I'm like, this is really happening? Like, I have to take this picture. But, so this was a few years ago, but a buddy of mine, a couple of years ago, went to another American College of Cardiology conference that I didn't make it to, and the times are changing. And so he sent me this slide. One guy on the stairs. The times are changing. So in conclusion, a plant-based diet is, I think, most supported by epidemiologic and mechanistic studies. We need a head-to-head study with a Mediterranean-style diet, but I do think a plant-based one is more optimal. Mediterranean diet, the more plant-based it is, it appears the better you do. And with the keto diet, we need more data. It appears that, there is some data that the more plant-based of a keto diet you consume, the better that you do. But I think the overwhelming majority of the evidence is not helpful for keto. There are other societal level trends in regard to cost. There's a UK and Belgium study where if people went even just something like 10% more plant-based, they would save billions, with a B, dollars in healthcare costs. And the Eat Lancet Commission came out with worldwide leading investigators, and they reported that they recommended eating more plant-based nutrition, both for human health, but also planetary health. Because really, at the end of the day, who cares how healthy we are if there's no planet? No planet, no health. So today, no one can deny the possibility of adequate nutrition and the prolonged maintenance of health and vigor on a vegetarian diet. This quote is from the Journal of the American Medical Association in 1912, before the term vegan was even coined. Thank you very much.
Support for the Preventive Medicine Lecture Series was provided by Geisinger Commonwealth School of Medicine, the Wright Center for Graduate Medical Education, and by valued donors.